Good afternoon, everyone. It's a pleasure to be speaking with you today at this Community Day on navigating disability and advocating at work. My name is Laura Fregeau. I'm an occupational therapist based in Montreal, Quebec, and I have a telehealth practice throughout the province, supporting individuals to live well with complex chronic conditions. I'm a Caucasian female in my late 30s. I have wavy brown hair and thick framed glasses. Throughout my presentation, none of the images on the slides really contribute to the content, so I won't be describing them orally. I've used these pictures as a way to include a reflection on the diversity of different work experiences that we may be coming to this task of advocacy from. To start us off, I have no disclosures to share. Here's a quick outline of what I intend to be covering today in the accessibility at work. And from here, I'm going to just dive right in. An accessible workplace is something that requires a collaboration between the employees and the individuals, the employers, and there's often systems involvement as well. So I want to start with an acknowledgement that though the focus of this presentation is on self-advocacy and how to connect with advocacy groups, there is that other level involved in really creating accessible work environments and finding our accessible work niches. I want to also state at the very beginning that this work starts with a reflection on personal safety and risk around setting workplace accommodations. It is an acceptable boundary not to advocate for your workplace accommodations within certain contexts and environments. Those of us with EDS and HSD, we have such varying functional capacities and varying experiences with our symptoms and activity limitations when we consider all of the co-occurring conditions that often come along with a connective tissue disorder. And we all occupy our own individual niches in the workplace. So there's no single effective pathway to self-advocacy at work. What I'm trying to do with this presentation today is present a series of reflective questions that flow from these large structural levels down towards the personal level, so that everyone who is watching this presentation today can have this opportunity to reflect on their own paths towards self-advocacy and employment. Starting at the governmental level, we can look at the question, what are my rights according to policy? So for example, in Canada, we have the Human Rights Act and we have the Canadian Accessibility Act. And these include policies on workplace accommodations across the nation. Given that this is a global presentation, I encourage at this step for individuals to look up their local disability accommodations. A first place to do this might be looking at a large language model tool like ChatGPT and using prompts like, what are the disability accommodations policies in the workplace in Canada? An important component here is to fact check the specifics of these policies that are shared through the language model. Another useful tool might be to look at legal literacy publications that might be available locally. In Quebec, for example, we have an organization called Éducalois that translate these complicated policy documents into easy to understand language. And there may be local resources to support you in this knowledge journey in your specific geographic location. One thing to look up along with the accommodations policies is, what are the limits of those rights within the policy? Certain statements and certain policies might have sectors like public and private that might have different disability accommodation standards within policy. And depending on the business size, typically 10 employees or less or 25 employees or less, these policies may not apply to such small businesses. So it's important to know those specific details to your context. And you can also, within this step, look up enforcement and remedy bodies. And so when this would come into, when a need for this would develop, would be if you have advocated for workplace access and accommodations, and these accommodations have been denied when you know that they are in line with your local policy. There may be pathways written within that policy that you can appeal these decisions and continue to move the fight forward. One thing that came up in the literature is that knowing these rights according to policy does tend to facilitate disability disclosure within the workplace. So when we have this knowledge, it facilitates our sharing of our need for workplace accommodations. Looking at sort of that middle level now of what are my employer's responsibilities around accommodations. A place that you could consider starting here is looking up your employer's internal accommodations policies. Some larger corporations or institutions may have these published on their websites or within their institutional working documents and policies. Other pathways forward may include connecting with human resource departments when these are available. This can be quite handy if you have access needs that will help you engage with the hiring phase, such as job applications and the interview process. And within this, you can get to know the process for requesting accommodations within that particular workplace from that particular employer. Another pathway could be to connect with unions to learn company-specific practices. One advantage here is that you can get to know more information about this particular company's internal accommodations policies without disclosing your disability to human resources from the start. Again, we all have personal contexts, and when we feel comfortable and we feel it's appropriate to disclose the disability information and request accommodations. So this is a way to find out also what are the differences between what's written in the policy and what is happening day to day within that organization. Often we know there are differences between policy and how they're enacted out in practice, and getting in touch with other employees and unions or employee resource groups can help to gain that information of what's really happening on the ground in terms of access and accommodations. Moving forward into the more personal and individual level, the next step would be assessing what are my support and access needs. I've divided this into two categories. Firstly, starting with getting to know our personal functional capacities. Here we can reflect and understand our range and our activity limitations. So I would encourage anyone who is doing this reflection to include all of their co-occurring conditions, because as we know, we don't exist in these different diagnostic silos. As we know, we don't exist in these separate diagnostic silos. We're living all of these conditions together at once. Often tools can be useful to map our symptoms and understand our activity limitations. In terms of breadth, I like to look at the Spider tool, which prompts reflections in the different body systems that are affected in connective tissue disorders. Other apps, like the Visible app is an example of one resource to map symptoms and to track symptoms, is something that can help you understand the daily fluctuations that you may be experiencing, and is really based on the symptom level. The FunCap questionnaire is the questionnaire of functional capacity. It is integrated actually into the Visible app, where you can complete this questionnaire once a month and look at those changes and cycles of functional capacity over time. And these are just reflection tools to help us gain that self-understanding of what our functional capacity is, so that we can understand our access needs better. Some factors that I would suggest including here are reflecting on specific items in the social and environmental factors, like frequency of medical appointments. We may have seasons where medical appointments and medical testing is very frequent, and seasons where follow-up appointments are quite far apart. So it's something to consider in terms of workplace accommodations. Another might be caregiving responsibilities. These are heritable conditions that we're talking about. So many parents are caring for children who have connective tissue disorders, or are caring for elderly parents or aging parents who have connective tissue disorders. And so we may have inflated caregiving responsibilities to consider in terms of the flexibility we may need in our work schedule. We also may want to reflect on previous experiences with accommodations, reflecting on those facilitators and those barriers to gaining access to those accommodations and learning from those past lessons. The second phase of understanding our own access and support needs is getting to know our individual work duties. This involves knowing the detailed tasks associated with your particular job. Here, I would recommend using an existing framework for job task analysis. And what a task analysis is an occupational therapy tool where we really break down an activity into the minute little steps, considering everything about the environment, the body positioning, the movements that are required. So it really looks at these job tasks in fine detail. One example is that's provided online by the BC Cancer Agency. Because it is focused on that job analysis and those work tasks, I do find that it is applicable in the EDS HSD population as well. And it's a very detailed and long PDF document that can guide this job analysis and really ask those specific questions. And through understanding our activity limitations and work duties is where we find where we need those accommodations. So an example I might give here is if I'm an individual who is waking up with significant symptoms in the morning and requires a routine of self-care before starting the day, I may have a work duty where I'm expected to be in a team meeting at the beginning of every day. So an accommodation here may be starting a team meeting at a specific time that accommodates that morning self-care routine. When it comes to which accommodations are going to meet your own set of particular needs, I could spend the rest of the time of this presentation moving through these examples. Rather, I'd like to present you with these search terms that you can then go and move forward exploring on your own these different categories and how it might connect with those activity limitations and with those job duties that you've just explored in details. These categories include physical and environmental accommodations. This may be what employers think of immediately in terms of office ergonomics, avoiding repetitive strain injuries. For those of us with dysautonomia, it might include having more temperature control in your corner of the office. Technological and assistive devices, again, vary across different work roles. Job restructuring and duty modifications is something that would really involve collaboration with the managerial aspects of your employment. Another component could be flexible scheduling, modifying policies, remote work or telecommuting. This is something that's been quite important in my practice in the past few years as more and more workplaces are requiring more time in person, which does not necessarily fit with the self-care needs and the pacing that supports the health of individuals with EDS and HSD. And I do a lot of advocacy work in terms of being able to maintain hybrid working that prioritizes working from home. Communication accommodations, transportation assistance, training and supervision adjustments, And another one may include infection control and prevention. This is another piece of advocacy work that comes up often in my practice, is advocating for individuals in public-facing positions to continue masking as part of their work role for infection prevention. So once we know which accommodations we think will support us in our individual role with our individual activity limitations, how do we go about requesting and implementing these accommodations? We touched upon procedures earlier on when we were talking about those employer rights. So here, I'd like to move into the prioritizing of accommodations. If you're anticipating some friction when asking employers or managers for these accommodations, factors that could be considered is starting with the accommodations that are most likely going to improve performance, perhaps accommodations that would most likely support a continued presence at work. Another factor to consider may be low or no cost accommodations, which may be a stepping stone to getting the accommodations started should your employers or managers cite financial concerns in terms of a barrier of putting accommodations in place. Another strategy could be accommodating a whole group may be more attractive to a manager or employer. Another factor that could help to move these accommodations and implement them within your workplace would be to share with your employers or managers evidence of the positive impacts of accommodations that we see in the literature, which include increased productivity, resolution of work problems, and promoting an accepting atmosphere. What other resources might be available should there still continue to be difficulties accessing those accommodations at work? Connecting with local support and advocacy groups may know of well-reputed workplaces within your sector and within your geographic location that have good reputations for accommodating individuals with disabilities and creating an accessible work environment. Another example could be to connect with online communities of disabled individuals who share your career or vocation. They may have ideas for very specific and granular, detailed accommodations that could support you within that specific role that you all fill. Other options include connecting with disability and employment advocacy groups, such as the Job Accommodations Network, organizations like Chronically Capable, and the Association of People Supporting Employment First. Another option, should this be available and accessible to you, would be to consult with an occupational therapist. There are occupational therapists who have a focus on vocational rehabilitation, and they can help work with you throughout the entirety of the steps that I've outlined today, from looking at policy to really letting you know what those different accommodations are that match your particular needs, so they can help to provide a breakdown and more information and resources that can apply to your particular context. If you are new to self-advocacy, it's a skill like any other. So sometimes it's something we need to develop and practice to improve our self-advocacy in the workplace. One thing that I may suggest here would be to find opportunities for advocacy in a low-risk environment. This would allow you to get to know your style of communication and comfort level. An example I would give is when I advocate for myself in doctor's office waiting rooms when I need accommodations for my orthostatic intolerance for a long wait for a specialist. It was not easy at first, but the more I've done it, the more I've practiced, the more confident and comfortable I've become. Trying to advocate for another person's need first. This recommendation is really directed towards those who maybe have been diagnosed later in life and are used to pushing through their own symptoms, perhaps masking in the workplace. Sometimes advocating for someone else is a bit easier than advocating for ourselves. So it could be a nice stepping stone to build those skills before we turn those that advocacy back onto our own needs. Again, in the same vein, advocating with a partner or a group can help build that confidence. Another opportunity here would be to enroll in advocacy programs, such as those that are offered through the Ehlers-Danlos Society's ECHO programs. Other options could include connecting with coworkers and allies within your employment. And again, as mentioned before, learning from those past experiences, the barriers and facilitators in order to continue advocating. One thing to conclude this line of questioning that I wanted to mention, that if workplace accommodations are unavailable or inaccessible in this moment, which is why I started the presentation with that statement, there may be other ways to support your health and well-being by decreasing demands and adapting occupations outside of work. Here, I mention this in particular because in my own experience in workplaces that were not accommodating, I lost quite a bit of my work-life balance as I was pushing through work and resting, pushing through work and resting. I hadn't yet moved that accommodations piece into my other activities of daily living. Some options include planning adapted leisure activities that fit within that resting and energy giving activities, maintaining social connections with accommodations. This could mean changing the time of day that you get together with family or friends, changing the environment so that it best suits your needs, and ensuring to make time for those supportive self-management tasks that are so important in maintaining our well-being, that are sleep, nutrition, movement, and stress reduction. So these can also happen outside of the workplace as well to support our overall well-being, both in and outside of work. So I hope these questions have allowed for reflection so that within your particular role, you've seen yourself somewhere and started those reflections. And I really thank everyone for their attention this afternoon. Thank you.